online. So I'm going to talk about intrauterine contraceptive device and its failure rate, because we do use it, especially in endometriosis and these cases. So when we look at IUCDs or intrauterine devices, and these have been used extensively with its provision having increased, including those of postpartum as well as emergency contraception. So if you generally look at this and say, well, why do we need to have a better idea of it? Because we can counsel our patients much better. So if you also look at is that anatomically we are putting it at different times. We're giving it to postpartum breastfeeding women and also using it for emergency contraception. Also, it depends on haptics, and that's again a reason why we would be looking at a slightly different complication rate. So in the Lancet came an excellent review by Susan Reed in the Apex IUCD study, which came up with a unique design using a large number of cases and looked at its complication. So it looked at 17 years of IUCD perforations over 300,000 patients with a follow-up between 1 and 4 years. Furthermore, 29,000 patients were with more than 5 years of follow-up, and 7,000 patients were in the postpartum group. If you look, when she looked at the findings, the rate of perforation was 1.57 every 1,000 person years of follow-up, compared to the postpartum of 3.8 per 1,000 person years of follow-up. Also, women who were breastfeeding had a higher perforation rates. Perforation rates were also higher in postpartum from 4 weeks to less than 6 weeks. And it's recommended that in postpartum period, as well as in IUCD with breastfeeding, it may be better to do it under ultrasound guidance. Now, the timing of perforation was about 5.7% at the time of insertion, 21.3% within a month of insertion, and the rest was after. Now, that is a problem. So you exactly don't know the risk of, the real risk of perforation, mainly because many of them would be asymptomatic. But it's important to realize that the risk of overall uterine perforation is extremely small, and thus the IUCD can be offered to a large number of patients. Now, research such as the Apex IUCD study informs that if you can counsel patients to a small risk of perforation, but otherwise a safe contraception, and many of us would use it for endometriosis treatment. And care should again be taken with postpartum as well as women